unprecedented shortage of critical drugs in the United States, a dangerous shortfall that, in extreme cases, forces doctors to decide who lives and who dies. Fox News exclusively obtaining a new congressional report that claims the FDA is largely to blame. Chief Congressional Correspondent Mike Emanuel live in Washington with that. What is the nature of the problem here, Mike?
Well, John, the House Oversight and Government Reform Committee's report says Food and Drug Administration enforcement activity has led to critical shortages of generic injectable medications. The committee says FDA regulatory activity has effectively shut down 30% of the total manufacturing capacity at 4 of the country's largest producers of generic injectable medications. Of the 219 drugs listed on the pharmacist shortage list, the report says at least 128 were produced by at least one facility undergoing FDA remediation. Congressman Trey Gowdy calls this a huge problem.
The numbers, I can't give you the numbers. I can just tell you that when you're dealing with children's lives, and this, the greatest country on the face of the earth, we should not be having this conversation. So it's a big problem to me, which means if I were the FDA, I would be ready to provide some answers shortly.
Gowdy's colleague, Chairman Darrell Issa, says the shortage appears to be a direct result of over-aggressive and excessive regulatory action. John?
So is the FDA responding to this criticism?
Just moments ago, they say preventing drug shortages is a top priority for the FDA. A spokesperson tells Fox, quote, "We recognize that the problem of drug shortages is complex and stems from an interconnected series of factors. However, manufacturing and quality problems continue to account for the majority of current shortages. These issues have mainly occurred with sterile injectable drugs. Patients expect and deserve high-quality drugs, and the FDA is committed to working with industry to quickly resolve any quality or manufacturing problems that arise to ensure continued patient access to vital, safe, and effective medicines." So it sounds like when Congress comes back next week, they're going to have the FDA sit down, perhaps some industry, and try to sort this problem out. John?
Yeah, let's hope they can get it figured out. That sounds pretty bad. Mike Emanuel, thank you.
Thank you.
Well, now this Fox Business